Dear friends and experts, I'm Sun Haiyan, a doctor of TCM Internal Medicine Department of Zhejiang Provincial Hospital of Chinese Medicine. My topic is taking Zhi Gan Cao Tang as an example to explain the application of classic prescriptions in senile diseases. So, what are classic prescriptions? We have different opinions on it. Some believe that classic prescriptions refer to those summarized before the Han Dynasty. For example, the book History of Han Dynasty records 11 monographs of classic prescriptions, including 274 volumes. Unfortunately, they are lost. But other classics recorded in the book are remained, such as Huangdi's Internal Classic and Treatise on Cold Damage and Miscellaneous Diseases, which contains Treatise on Cold Pathogenic Diseases and a synopsis of Golden Chamber. Hence the second opinion. Classic prescriptions refer to those recorded in these classics, or especially those in the Treatise on Cold Pathogenic Diseases and the synopsis of Golden Chamber. Prescriptions appeared after the Song Dynasty are called current prescriptions. Why are classic prescriptions so important in TCM? The key is they reflect that under the historical background and the guidance of philosophical thinking, how TCM perceives human body, disease, the world, society, and nature. The key point is the way of thinking, the philosophical methodology. Then I'd like to talk about Zhi Gan Cao Tang. In the Han Dynasty, a famous doctor Zhang Zhongjing wrote the treatise on cold pathogenic diseases. Clause 177 in this book says, for cold pathogenic diseases with an intermittent pulse and severe palpitation, Zhi Gan Cao Tang is applied. Here are the ingredients. In this formula, Zhi Gan Cao is the sovereign medicinal. It is sweet in flavor and warm in nature, which can supplement qi, dry channels and vessels, benefit blood and qi. Minister medicinals are Shengdi, Huang, Mai Dong, Ejiao, and Maziren. They can benefit heart tea, nourish heart blood, and supplement blood. The other group of minister medicinals are Renshen and Dazao. They can supplement qi and engender liquid. Assistant medicinals are Guizhi and Shengjiang. They are pungent in flavor and warm in nature, which can activate yang and regulate blood circulation. The guiding medicinal is rice wine. It is pungent in flavor and heat in nature, which can warm and dredge blood vessels, helping the formula exert its effects. Therefore, the compatibility of the sovereign, minister, assistant, and guiding medicinals has effects of supplementing heart tea, nourishing heart blood, warming heart yang, and activating heart qi. In the text, an intermittent pulse and severe palpitation describes the patient feeling restless or sort of scared because of the heartbeat and having a pulse with intervals. This kind of pulse moves slowly and stops sometimes, so it can be divided into irregularly intermittent pulse and regularly intermittent pulse. For treating such patients, Dr. Zhang Zhongjing prescribed Zhi Gan Cao Tang. As we can see, the ingredients are decocted with rice wine. In the end, Ejiao is added. Since the prescription aims at intermittent pulse, it is also called Fu Mai Tang, a decoction for recovering the pulse. Clinically, we can find abnormal ECG such as frequent mature beat, atrial or ventricular. Dynamic ECG shows bigeminy or trigeminy. Even atrial fibrillation can be found. Besides the abnormal pulse, the patient feels palpitation, restless, and so on. After introducing Zhi Gan Cao Tang, the treatise on cold pathogenic diseases also describes the pulse. As I just mentioned, it can be divided into irregularly intermittent pulse and regularly intermittent pulse. The difference is regularity of intervals. When it comes to yin-yang properties in TCM, the two pulses have a yin nature, reflecting insufficiency of qi and blood. Now, I'd like to share a clinical case recorded in another book. Such historical medical records in TCM are vivid, like telling stories. Here's the case. Excerpt from Records of Clinical Application of Classic Prescriptions written by Dr. Cao Yingfu of the Qing Dynasty. The case reflects the effectiveness of Zhi Gan Cao Tang. There was a lawyer who came to visit Dr. Cao. His sleeping and eating were normal, but his pulse was intermittent. To be specific, after beating for 10 times or 20 to 30 times, there was an interval, not regular. In addition, the patient was busy and felt palpitation and restless. His manifestations were just like what Dr. Zhang Zhongjing said in the clause. Therefore, Zhi Gan Cao Tang was prescribed. Including the ingredients 炙甘草、生姜、桂枝、党参、生地黄、阿胶、麦冬、麻子仁 and 大枣。About 10 days after taking the prescription, the patient recovered. The core of the disease is firstly the main symptom, palpitation and restlessness. Secondly, the main sign, the intermittent pulse, which beat for 10 to 30 times and stopped once. They are consistent with Zhang Zhongjing's description, so 炙甘草汤 is applicable. Combined with my experience in using 炙甘草汤 clinically, as long as syndrome differentiation is accurate and application of 炙甘草汤 is appropriate, the efficacy is considerable. Recently, a 64-year-old patient came to visit. She had recurrent chest oppression accompanied by palpitation but no chest pain. The symptom lasted for more than 4 months. If she got emotional, she would have dizziness and a distending feeling in the head. If the upper right chest was invaded by pathogenic cold, she would cough. Her appetite and defecation were normal. She also had soreness of waist, fatigue, and a bad sleep quality. She took diazepam for help. Even so, she could only sleep for 5 to 6 hours. Her tongue was red, slightly dark. The tongue coating was thin with cracks on the front of the tongue body. The pulse was moderate. At that time, no obvious intermittent pulse was found. For medical history, no hypertension or diabetes, and no heart diseases in her family history. She brought her physical examination report showing that it was normal in blood biochemistry. However, carotid artery ultrasound showed plaque formation in the left carotid artery, with an area of 4 mm multiplied by 0.8 mm. Based on the patient's self-report about chest oppression accompanied by palpitation, I thought of the clause, even though there was no obvious intermittent pulse, so I prescribed modified 炙甘草汤. As we can see from the PPT, I marked the ingredients to better display the structure of the prescription. Ingredients with a brownish red color are from the original 炙甘草汤. Considering there were cracks on the tongue, I added 白芍 for nourishing in blood. In this prescription, 炙甘草、大枣、桂枝、生姜 and 白芍 form the formula 桂枝汤. Adding 龙骨 and 牡蛎, the formula becomes 桂枝 plus 龙骨牡蛎汤, which is also recorded in Zhang Zhongjing's treatise on cold pathogenic diseases. 龙骨 and 牡蛎 were used for tranquilization. aiming at the patient's palpitation, bad sleep quality, and insomnia. Moreover, 怀小麦, 百合 and 合欢皮 were added. 怀小麦 aimed at the patient's fatigue, palpitation, and chest oppression. 怀小麦, 大枣 and 炙甘草 are ingredients of 甘麦大枣汤 created by Zhang Zhongjing. The formula is suitable for hysteria in female, aiming at insufficiency of visceral yin and correlated symptoms. Here, 怀小麦 can supplement heart qi. As for 百合, according to Zhang Zhongjing, he used 百合地黄汤 for lily disease. The formula consists of 百合 and 生地黄, which can nourish yin of heart and lung, clear heat of heart and lung, based on the patient's manifestations of fatigue and other symptoms of deficiency, as well as the cracks on the tongue. The patient suffered from insufficiency of heart qi, heart blood, heart yin, and heart yang. Therefore, 百合地黄汤 was applied to nourish heart yin. Meanwhile, 百合 could calm the mind. 合欢皮 was used for relieve depression and tranquilization because when the patient got emotional, she felt dizziness and distending in the head. I prescribed 5 doses for the patient since the diagnosis was not clear. I suggested her get relevant examination, such as ECG, dynamic ECG, and echocardiography, so as to detect if there were arrhythmia and structural changes of the heart. The patient was worried about coronary heart disease. Although her blood lipid and blood pressure were normal without a history of heart diseases, there was a plaque in the left carotid artery. I also prescribed her coronary CTA. 5 days later, the patient came back to me. Dynamic ECG indeed showed frequent atrial premature beat. Echocardiography showed obvious pathological changes. Coronary CTA showed small non-calcified plaque and mild lumen stenosis, but there was no need for a stent. So for this patient, treatment with Chinese medicine is suitable. Now let's have a look at the feedback of the patient after taking medicine. She said chest oppression was relieved obviously and palpitation disappeared. Soreness of waist and mental state were largely improved. Sleeping was the same as before, 5 to 6 hours, light and easy to wake up, but she took less diazepam. We can see from the photo that the tongue is reddish with thin coating. There are cracks on the front of the tongue. According to the record of the first visit, the tongue was red and dark. Because of insufficiency of her heart qi, blood, yin and yang, blood circulation was weak, so the color was dark. However, after taking Chinese medicine, heart qi, blood, yin and yang was supplemented, so the dark color of the tongue was relieved. Since the tongue manifestation still indicated deficiency, I changed the one ingredient of the prescription. 合欢皮 was replaced by 味子, which can tonify heart, calm the mind, and benefit kidney. The patient lives in another city, so I prescribed 14 doses for her. Recently, during the follow-up, her daughter said that the condition was good after taking the medicine, no chest oppression and palpitation. Sleeping was still in regulation and better than before. The case shows good efficacy of Zhi Gan Cao Tang in clinical practice, and I'd like to share my reflection and inspiration. Firstly, thinking ways of diagnosis in TCM and Western medicine are totally different because they originated and developed from different philosophical bases. TCM focuses on qi, blood, yin and yang, which are metaphysical, while Western medicine emphasizes substances which are physical. Secondly, elderly patients usually suffer from consumption of qi, blood, yin and yang. So clinically, they have more complicated diseases and more symptoms. Integrated Chinese and Western medicine can help patients build up vital qi and eliminate pathogenic factors. Certainly, in terms of classic prescriptions, even though they appeared before the Han Dynasty, they are still effective in today's clinical practice. The key is methodology. The way we see the nature, the human body, the diseases is effective. What's more, there is no good or bad between classic prescriptions and current prescriptions. Classic prescriptions are the model and current prescriptions show the development. For example, among the 4 major classics in TCM, there is detailed analysis of epidemic worm diseases. 加减复脉汤 is recorded in it, which is originated from Zhi Gan Cao Tang with 人参, 桂枝, 生姜 and 大枣 removed, and bishao is added. The formula aims at consumption of yin fluid in advanced stages of worm diseases. The formula can nourish yin in genital fluid and clear heat. Since yin fluid is consumed due to worm diseases, ingredients with a warm or heat nature are removed. Bishao is added because it can nourish yin blood and protect yin fluid. So current prescriptions inherit the essence of classic prescriptions, which is developed on the basis of syndrome differentiation and treatment. Proper use of both classic and current prescriptions can benefit patients a lot. That is all. Thank you for listening.